I'm Dr. Michael Lenz, an internist, lifestyle medicine physician, clinical lipidologist, and pediatrician. Welcome to today's video, where we'll be diving into one of the most controversial topics in women's health, menopausal hormone therapy. Is it truly safe? Why is there so much fear and confusion surrounding it? And what does the latest research actually tell us? We'll be reacting to an enlightening expert panel hosted by the FDA, where Dr. Heather Hirsch speaks in this segment, breaking down the most controversial points and examining how decades of misunderstanding have impacted millions of women's lives. Get ready for some myth-busting and evidence-based insights that might challenge everything you thought you knew about hormone therapy.
All right, so first, we'd like to hear from Dr. Heather Hirsch.
Well, good afternoon. I'm Dr. Heather Hirsch. I have no disclosures. I am a women's health fellowship-trained, board-certified internist. And on behalf of the entire menopause expert panel, I would like to say we are honored and excited to be here for this life-changing conversation. Our purpose here is clear: to provide concise and logical information in support of the safety of menopausal hormone therapy. I completed 2 years of advanced women's health training at the Cleveland Clinic, and during my training, I pored over the research, only to find something earth-shattering: that history got it wrong when it comes to menopausal hormone therapy. Now, we at times want to be logical, but may also be emotional, because we have seen the life-changing impacts that menopausal hormone therapy has had on women. For me, it was my patient Denise. In the middle of perimenopause, she woke up one night covered in vasomotor symptoms, alerted her husband, and said, "I'm having intrusive thoughts of harming myself," and he took her right to the emergency room. We are harming women by not having clear facts, and this is really important to discuss today. As we redefine harm,
Wow, Denise's story is absolutely heartbreaking and unfortunately not unique. It perfectly illustrates how misinformation and fear around hormone therapy can have devastating real-world consequences for women going through menopause. When we deny women access to effective treatments due to unfounded fears, we're not protecting them, we're potentially pushing them into crisis. This raises a crucial question. How many other women are suffering needlessly because of outdated beliefs about hormone therapy?
let's start by making some definitions. Local vaginal, or also sometimes referred to as topical estrogen, is estrogen that is placed inside the vagina and is FDA approved to treat genitourinary syndrome of menopause, which is painful intercourse or vaginal dryness, as well as recurrent urinary tract infections. Importantly, and we will discuss this today during the expert panel, this medication does not travel systemically. That means it does not go through the entire body. What we know is that it does not increase the risks of heart attacks, breast cancers, or strokes. No data shows that. However, there is a boxed warning inappropriately affirming that it does. Menopausal hormone therapy is the combination of an estrogen plus or minus a progestin or a progesterone if a woman has an intact uterus, with or without the addition of testosterone. The trouble with the term menopausal hormone therapy is it is poorly defined and very broad. What you will hear today is that there are specifics that matter. The route is important, meaning is it taken orally or is it taken transdermally on the skin? The formulation is important, meaning its chemical structure. And the time at which it is taken is also very crucial. Hormone replacement therapy is indicated for women who've had menopause before the age of 40 or 45 and is a medical necessity. A boxed warning, formerly known as a black box warning, is the highest safety-related warning that can be placed on a medication by the FDA. By definition, this means that the medication can incur serious and/or life-threatening adverse events. This makes patients and clinicians afraid of these medications, and it may be extraordinarily unnecessary, as we'll see from the evidence.
This is a perfect example of how regulatory decisions can have far-reaching consequences. The black box warning, while intended to protect patients, may actually be doing more harm than good. It's creating unnecessary fear and hesitation among both healthcare providers and patients. When we look at the actual evidence, especially for local estrogen therapy, these severe warnings seem completely disproportionate to the real risks. This raises serious questions about whether our current warning system is serving women's best interests.
With my 2 minutes remaining, I want to make 3 clear and concise points. Number 1, vaginal or local estrogen is categorically safe for all women, period. Because it does not travel systemically, there again are no increased risks of heart attacks, clots, or strokes. And the black box warning is wrong and should be removed. Number 2, systemic hormone therapy has warnings, again, that are broad and poorly defined. We are going to discuss important points today, such as the facts that in the Women's Health Initiative, or the WHI, estrogen alone decreased the risk of breast cancer statistically. And when we swap or switch the progestin in the WHI for different formulations of progesterone, we do not see any increased risk of breast cancers above baseline. And transdermal estrogen has not been shown to increase the risks of clots and may reduce the risk of cardiovascular disease if started within 10 years. And number 3, the gaps in training magnify the damage. Many clinicians receive an hour of menopause education, potentially like me, which was a voluntary lunch and learn lesson. This is crucial that we support clinicians and healthcare professionals in prescribing and managing FDA-approved hormone replacement therapy with ease and confidence. I am excited to hear this panel today because I do believe we are doing harm in the name of do no harm, and this is affecting 50 million women at any time who are between the ages of 40 and 60. Women deserve policy that reflects the current evidence and not outdated myths.
Thank you for joining us for this important discussion about menopausal hormone therapy. As we've seen, the gap between evidence and practice is affecting millions of women's lives. If you found this information valuable, please like and subscribe to our channel for more evidence-based discussions about women's health and chronic pain and fibromyalgia and other related issues. Share your thoughts and experiences in the comments below. Your story might help other women who are struggling with similar decisions. Together, we can work to dispel myths and ensure that women have access to the treatments they need.